Alright, let's try to make ECG easy. Now, ECG is a common tested subject in your final year MBBS exams, medical exams, FCPS Part 1, IMM, MSMD exams, PLABs, and whatnot. So let's get into it. The ECG records the electrical activity of the heart, and known as EKG in the US of A. I'll just focus the conduction of the heart from the SA node to the AV node to the bundle of His, bundle of branches, and precondylar fibers. Small review here. Now, this is important. You need to know right here below to the right side, one large square on the x-axis equals 0.2 seconds. One small square on the x-axis equals 0.04 seconds. So you've got the time on this axis, that is the x-axis, and in the y-axis your 10 mm high. So 1 millivolt is 10 mm high, and one small box is 1 millimeter. So one small box in the y-axis 0.1 millivolt, and 10 are equal to 1 millivolt. So you need to remember this. Small box 0.04 seconds, the y-axis 0.1 millivolt. Let's not get into how to do the ECG. It's not important for our examination questions. Let's just skip through them. Okay, first we need to know what the normal ECG is. It's right in front of your eyes, so let's get into it. P wave represents the atrial depolarization. Now, that is when your atrium will start to contract after it gets depolarized. The Qrs complex, it shows you the time when ventricular depolarization is happening. The T wave is when the ventricles are being repolarized. So you might ask the question, where is the atrial repolarization? Well, atrial repolarization has got this very small wave. It's hidden inside the Qrs complex. You don't see it, and we will not discuss it. Nobody would ask you except where is it. It's masked by the Qrs complex, the ventricular depolarization, which is much more in amplitude. Now, what is the PR interval? This is the P wave. We'll get to it later. All these waves, now most of them are P, Q, R, S, T. This is alphabetical. You've got a U around here. We'll mention that later. These are in alphabetical order. So P wave starts it off. The PR interval is from the start of the P wave and to the start of the QRS complex. It does not include the QRS complex. It shows you the time and the duration in which atrial depolarization plus the delay that is happening in the AV junction. Now, it gives you time for the atria to contract. This is the PR interval, start from here to here. Now you need to understand, how do we get these waves? If positive ions, depolarization, is moving towards the positive end of an electrode, you get a positive deflection. And ECG, so that means everything would go up, that is moving towards depolarization, moving towards positive end of the electrode. If it's moving away, then you've got a negative deflection, like this Q, like this S. That is why every lead is different. They're placed at different directions, so you get different positives and negatives. The P wave represents atrial depolarization, the QRS represents depolarization of the ventricle, the T wave represents depolarization of the ventricles, and PR interval, as we mentioned, time for electric impulse to travel from the sinus node to the AV node to the ventricles. And then you've got the J point, the end of the QRS complex. You need to note it for evaluation of ST elevation MI a little bit later on. This is the ST segment. We'll be discussing it in detail. It starts from the end of the QRS complex to the start of the T wave. The PR segment from the end of the P wave to the start of the R wave. The QT interval includes the QRS complex and the T wave as well. QT, most of the questions about QT are about arrhythmias or risks for sudden death. So the normal sizes are, the PR interval is less than 5 small squares. The QRS is usually less than 3 small squares, 0.12. That means the ST segment is less usually than 2 small squares. The QT is less than 2 large squares, but these can vary. Now let's get to the fun part, the interpretations. Now, first and foremost, you need to make sure that you're getting and reading the ECG of the person that you have to deal with. So you'll check the name, you'll check the timing, and all of these things. Here you have all the leads. These are an example from a 12 lead EKG. Now next, this on the right side you can see interpretation software. Well, it does help a little bit, but it's usually never reliable, so your brain is much more capable than this. You need to, in an ECG, be able to define what is the rate, rhythm, axis, how's the P wave, how's the PR interval, what is the Qrs complex like, is the ST segment fine, is the QT interval causing problems, T wave, U wave, their presence, and other ECG signs. Now these are the things that you need to do in a reporting of an ECG. In this video we will discuss the rate. Now my favorite way to find the rate is by this method, the second one. In a regular ECG in which there is no arrhythmia, you take 2 R waves and you calculate the number of small squares between 2 R waves. For example, they may be 20. Now the rate would be 1500 divided by 20. That would equal 75. Now this is easy. We'll get to an example right here. You can see between 2 R waves, here and here, and between them we've got how many? 2, 5, 7, 12, 17, 20, around 20. So this was 75. And you can also, if you're in a real hurry, calculate it by this method as well. You can calculate the big squares between 2 R waves and 300 divided by that number. So this is an example of that, and this is an example of the small box calculation. But what happens if the rate and the rhythm is not regular? Then you need to, a good method is, you need to count the number of R waves in a 6-second strip. How many is 6 seconds? 0.2 seconds for each big box. Now 5 boxes for a second and 30 boxes for 6 seconds. So in 30 big boxes on the x-axis, you calculate the number of R waves that you are getting, and then you can multiply it by 10 to make it 60 seconds. So if you're getting 8, you multiply it by 10, you've got 80 as the rate per minute. Now normally it's 60 to 99. A bradycardia would be less than 60. These are the causes. You can pause and see them. Tachycardia is more than 100. This is where I'll end this video, and we'll continue with the next video that would tell you about the rhythm, the axis, and ST elevation, ST depression, T waves, and all other things. So stay tuned.